the veins take the blood from various nook and corner of our body to the heart. So they are called veins. And the flow in the veins is controlled by the muscular action in the legs. Otherwise, when the person is standing, the blood has to flow against the gravity. So it happens only because of the muscular actions. Many times these veins also fail. Why? Because within the veins there are certain valves which maintain the flow, and the veins become dilated and the valves become incompetent. So because of that, the disease which we encounter in the veins most commonly is called varicose veins. You all might have heard the veins have become very big, they are dilated, tortuous, and then many persons walk around with these dilated veins without getting consulted. So what we have to do in such cases and what are the problems? I am Dr. Muralidhar. Today we will discuss about the problems with the veins. As I told you, in our body, which are the veins? The veins take the blood from various nook and corner of our body to the heart. So they are called veins. And the flow in the veins is controlled by the muscular action in the legs. Otherwise, when the person is standing, the blood has to flow against the gravity. So it happens only because of the muscular actions. Many times these veins also fail. Why? Because within the veins there are certain valves which maintain the flow, and the veins become dilated and the valves become incompetent. So because of that, the disease which we encounter in the veins most commonly is called varicose veins. You all might have heard the veins have become very big, they are dilated, tortuous, and then many persons walk around with these dilated veins without getting consulted. So what we have to do in such cases and what are the problems? See, as you know, when the blood in the veins don't flow properly, definitely the blood which is coming into the muscles is also reduced. So they even start getting throbbing pains in the muscles. When they stand for a long time or when they walk for a distance, they get pain in the muscles, and that is because of lack of flow of blood in the veins, and which means that there are no adequate quantity of blood which is coming into the muscles. So because of this, we have to treat these veins. The other reasons why we need to treat these dilated veins is because in case the dilatation crosses a certain level, it may rupture and cause bleeding. So it happens sometimes when you are traveling, or when a person has gone to a remote place where he may not have access to a doctor. So if it happens, he gets tensed. So we advise them to get treated for varicose veins because to avoid bleeding. And many times it can also happen as clotting, because the flow of blood is slower and the blood is sometimes not at all flowing, so the blood clots. So what we call as deep vein thrombosis. So all these complications happen in varicose veins. So we need to treat varicose veins. How do we diagnose whether he has a varicose vein or not? We do again the same test as color Doppler, which says these are the points where the blood flow is reversed. So there is reversal of blood flow. So we need to treat at those places. It can happen at junctions like in the upper thigh or behind the knee. So we need to treat at these two places. And there are minor perforators which also can become incompetent. So we need to find out which are these incompetent perforators using Doppler. Once we find those incompetent perforators, then we need to treat at all these places. We used to do surgeries for varicose veins, but of late there are other methods which have come into vogue. The laser is very, very handy. We do treat these varicose veins using laser, we call as endovenous laser. There are other methods like RF, that is called radiofrequency. By these techniques, now we can obliterate the dilated vein, and then there are normal veins which take over, and they carry out the flow of blood into the abdomen. So, how to prevent these varicose veins? We have to be careful. One has to have a knowledge of these varicose veins. Again, obesity increases the varicosities in the vein, and so one has to maintain his weight. One has to be fit. He should not become overweight. The other means are to keep all the time activity. One should not be bound to a chair, or he should not have a sedentary style of living. One has to be active, then only the flow of blood is always kept patent, and then the varicose veins will not happen. So one need to concentrate on obesity, keep the weight in check, and then keep moving, and then don't sit for a long time, as sometimes it happens with our software engineers, where they are sitting with a computer, and probably 6 to 8 hours of sitting will definitely cause lack of blood flow. Means the activity is reduced, so the blood flow will not happen, and then the blood tends to clot, or sometimes the blood vessel tends to dilate. So we need to be careful. So these are the methods by which you can prevent progression of varicose veins. So keep yourself fit, healthy, and avoid overweight. We all know that the varicose veins sometimes is common in females, where it is common in postmenopausal ladies because of these hormones which are prevalent in those ladies during that age. See, normally they get little varicose veins during their pregnancy, when the large head of the baby presses on the pelvic veins. Some of the veins in the legs, they become dilated. And they also say that during the post-natal period, these veins were dilated, which regained their strength and went back to their normalcy. But when they come to the age of menopause, again there are certain hormonal changes which again make these veins weak, and the veins become bigger, and because of that they develop varicose veins. So we have treated a lot of postmenopausal ladies with varicose veins, so they have to be careful. And this, at this age, they tend to become obese, so they have to reduce their weight, and they should keep maintaining their fitness by doing regular exercises, by which they can prevent varicose veins.